My name is Erna Solberg. I am the Norwegian Prime Minister.
Norway and its 5.4 million people offer a compassionate and effective model in the way it's responded to COVID-19, putting humanity at the center. As of early June, 238 people had died, much lower than in many parts of the world. In parallel, is contributing to the global development of life-saving treatments. I'm James Chau, and in this part of this special interview, it's my honor to speak with Prime Minister Erna Solberg about science, solidarity, and leadership. This interview is a partnership between the China Current and SHE, the community, conference and movement that's leading the global fight for gender equality. Prime Minister, Norway has pledged $1 billion to the global COVID-19 response, and the focus of your funds will be on the development of a vaccine. This is a health emergency, but it's one that also carries enormous economic and social dimensions. So will a vaccine be enough to turn the corner?
I think the vaccine is an important starting step to get into a more normalized situation. I think we need a vaccine to make sure that we can go back in the same way as we used to work, that we can cut out the social distances, that we can take care of vulnerable people in our society. And I think that's an important step to start to solve all of the other issues that arises from the COVID-19 disease and the fact that we have a pandemic that is not just a health crisis, but also is in a way a socio-economic crisis all around the world, with people with jobs lost, with economic development going backward. The vaccine is the answer to getting more back to normal. We of course try to combat and to keep control over the disease, but it's difficult in a globalized society to make sure that, eradicate a disease like this, which is quite contagious and have moved so more or less all countries in the world have been affected.
May we look now at Norway's response, because you've had one of the lowest numbers of deaths and also the lowest numbers of infections. And if we look at the big picture, you decided very early on to go in early, to go in hard, and not to look back. And you've also been crafting your public policy based on science. But I was also wondering how much of this quote-unquote success also has to do with culture and mobilizing the society in Norway.
When we decided the 12th of March to close down a lot of the activity in our economy, including closing schools, we made that because at that time we were number 4 in Europe on numbers of people who are infected. We had this very quite rapid rise in the beginning due to the fact that it coincided, arrival of the sickness in Europe coincided with a winter holiday in Norway, and there was a lot of people going to Austria and northern Italy to ski, and we got a large influx of people coming back being ill. So in a way, we started early, but we had a high number of people who were infected at that time. And because I think that gave us, the right for concern. From the first who was infected on the 25th, 26th of February, up until 12th of March was a quite short time limit, but it was a high number. So when we closed down, I think we got control over the disease quite rapidly. I think the reason why we did that is, well, it's at least twofold, if not more. I mean, yes, we did strict regulations, especially on some of the person-to-person services, on bars not being open, schools being closed. But it also, I think, gave us the sense in our society that this is real, this is something I have to follow. And we have this communal spirit in our country that it's not about raising the finger and telling people you have to do that, but, explaining it. We are in this together, so people would align to it. They went home, they started to work from home. We are a quite digitalized society, so it was easier for people to continue to work, being at home, but they had to homeschool their children at the same time with the help of the schools. So it was a burden for people. We did not close down with a lockdown so that people couldn't go out. In fact, we said the opposite. We said, yes, you need fresh air, go out. We are a country with a lot of space, so you can go out, get fresh air, but keep distance. Keep yourself to your own family and not be in groups that are more than 5 people. And people stuck to this for quite a long time. Even the young people, which we have felt very sorry for disturbing their, you know, when you're from 16 to 20, every spring is the most important part of your life. You will never get the age of 17 or 18 back again. So I think it's important that they also stuck, in fact, with the type of regulations, and that's why we also quite rapidly could start reopening, because we got the numbers down. And I think yesterday, there was 8 or 9 persons in Norway who were new infected, and we still have stricter measures on bars, for example, and on social distancing, but the numbers are very low.
If we look back to last September, you were at the UN General Assembly and you launched with Germany and Ghana the Global Action Plan, which aims to speed the work of the Sustainable Development Goals to the year 2030, and I suppose even far beyond that as well. Is there a fundamental experience from that important work that you lead globally that we can repurpose for COVID-19 and then for the next pandemic?
The understanding that health issues is affecting all other sectors, that issues are interlinked. When we talk about the Sustainable Development Goals, we often talk in sectors. We talk about education, we talk about health, but they are all interlinked. And we live our life in an interlinked society. That's why we need to join forces together on all of this issue. Health is extremely important, you know, to see results both in economy, but also in education, in the development of our societies. And that's why investment in health is an investment in a fairer and more inclusive society. And that's one of the main aspects of the Global Action Plan, was in fact to make that clear statement that these are interlinked. And we have to take that with us in the future, meaning that when you look at how do you empower countries to grow economically, investments in health that is inclusive, you know, universal coverage is important. Education is important, because there's the impact between education and health is very big, especially in poor countries. If you have a better health system, you will get more young people who can finish and go through school, but it will also reproduce itself in a better health situation in the future. Because when people are more knowledgeable about their own health, they will also take more control over their own bodies, their own life, and live healthier life.
You can listen to the full conversation with Erna Solberg at ChinaCurrent.com or your preferred podcast platform. This interview is a special partnership with SHE, the community, conference and movement to achieve global gender equality. Be a part of the transformation and join their call to action. You can sign up at sheinsight.com.